Hello, everybody. Welcome. Thanks for joining me today. I'm Megan. I am an Archer Review tutor. I've been here for a little while, and we're going to talk about some study strategies, specifically next gen nursing, right? So I can't wait to talk to you, all of you. I would love to just kind of share you some other Archer Review topics that we have at the top at the very end of our session and go from there. But it's really important for us to know what type of learning style we have. So let's take about 10 minutes to get this easy study that guides to see how you can determine how you best learn. Now, I will tell you there are many, many different types of learning styles out there, and there's lots of combinations. If you don't know what type you are, you can always Google a free online quiz just to see what you are. But let's actually talk about it. So we have our three main types: visual, auditory, and kinesthetic. Visual is you really like illustrations, PowerPoints, graphs, pictures, anything of that nature. Auditory, you can listen to recorded lectures or live lectures, right? You can read notes, you can do group discussions, podcasts are really good, and one-to-one conversations. Just like discussions really help with that. And then we have our tactile and hands-on activities. I will say a lot of people do this too in combination with other things. So you like to have making concept maps, relating to client scenarios, note taking and role playing. And again, guys, knowing that you can have a lot of combinations with this is going to help. Now, me, myself, and I am a combination of auditory and our tactile, kinesthetic. I can sit there, you can sit there and preach and preach and preach to me about what is going on. If I can't, especially like IT stuff, I have to go in there and play around with it to see how it is. So I want you guys to think about yourselves. What learning style do you use the most? Just think about it for a second. And it's going to be really important because that comes into play about how you actually studies. So think about, how have you studied in the past? Has that worked for you? What hasn't worked? And what new methods do you want to implement based on your learning style? The biggest thing is consistency is key to success, and that's really important. So think about what has worked. Changing up your studies methods is okay. It really is. So if you change that up to kind of, it's like a trial and error, guys. You want to try to see what's going to work, what's not going to work for you. So think about that again. How would you rank your current study habits? Are they working for you? Are they not working for you? How can you change it up based off that learning style that you just learned that you could be? And again, if you don't know what it is based off of what we talked about, you can Google free quizzes to see what type of learning style you are. That can actually play a big part of it, especially if you think that you're sitting here doing the same thing over and over is not working for you. Maybe you're not studying per your learning style. So what are some different ways to study? Guys, I always like to think practice questions are actually a huge study method. You can learn so much just by doing practice questions and reading the rationales along with those practice questions. Then we have our notes. Again, note taking is really important, but you always have to remember you have to go back and read those notes. So you sitting there and taking notes is fantastic, but do you go back and review and read those notes? Flashcards. Flashcards are really good for those people that need to do those, have that visual slash kinesthetic, I always say tactile motions because it's kind of doing both of them. Sometimes just listening is another thing. That's where that kind of conversation, one-on-one conversations come into play. Sometimes looking at images, teaching someone. I love this one. I joke all the time. My husband, who was my boyfriend back in nursing school, he thought that he could take it the NCLEX whenever I did because I taught him everything. He was my study partner. He didn't know what I was doing. He didn't know what I was saying was accurate or not. But he obtained some information and it helped me. So even if you don't have somebody that's in the healthcare field, it's okay. Still teaching it's going to be important. If you do have people that are in the healthcare field that could correct you, that's even better. Other ways too, guys, I like to think about to ways to studies is if you can connect the dots to patient scenarios, circumstances that you had, that's going to kind of help things, situations too. Another thing too is knowing what you don't know. How do you know that? How do you know what you don't know? Successful studying really means figuring out what you don't know and relearning it. It's just another step of it. So, what things would you put on your list of confusing topics? This is a self-analysis that you can do to determine what you don't know. Sometimes it's even weird that you think that you are crushing it at maternity because you love that topic. But then you go back and look at your questions and your analysis of your test that you've been taking, and you're not doing so hot in maternity. So always staying on top of that to constantly review what you really don't know. Keeping a list of confusing topics. I say this all the time whenever I am working with people one-on-one in intense prep. If you are sitting there and you are reviewing your rationales, guys, my notebook that sits at my bedside, my desk is my best friend. I always constantly am taking notes and keeping a list of confusing topics that could be on there. Because if you're constantly repetitively missing the questions about a certain topic, write it down because you need to brush up on that content. That's why analyzing those past tests are really important. And always utilize your resources to the max, guys. I always recommend 1 to 2 resources. One primary resource for exam questions, because you get used to knowing how that resource writes their questions, asks you things, explains things in the rationales, etc. Then you should always have a backup resource. That way that if you say you're watching an Archer review content on-demand video on fluid and electrolytes, say the way that Morgan is explaining it is really confusing to you. That's okay, right? Because I don't explain, sorry guys, I don't explain the same things the same way other people explain. So having another backup resource is really going to help with that determination of maybe someone just explained something a little bit differently. But I can't stress it enough, guys. There is a huge difference of memorizing versus understanding. I just had a conversation about this a little bit ago. How many of you got through nursing school or in nursing school trying to get through one test to the next test, just trying to complete assignments, right? You're memorizing. You're remembering that list, definitions, repeating information. It's very surface level. But guys, the sad part is you are going to forget that very quickly. It is not going to be successful for NCLEX. You really need to start working on the synthesis and understanding of that information. Being able to apply those concepts to new situations, because what is NCLEX, guys? It's applying the knowledge that we know, right? I want you to really apply certain concepts to situations, right? So when we talk about interventions on about poor perfusion due to coronary artery disease, NCLEX is going to ask you about different disease processes that you probably haven't heard about, but it affects perfusion and it affects that decreased perfusion. But you know that because you understand what decreased perfusion is and what it's about. So it's really important for us to be able to convert that understanding and studying into the understanding portion of it. This is really important when you go to the whys. So if you are answering a question and you can tell yourself why that answer choice is wrong and why that answer choice is right, then you understand that content. If you can't do that, then you do not understand that content and you're working on that memorization. So think about this again. Have you spent more time memorizing material or understanding material? Right? A lot of you are spending time memorizing that material. And we really need to work on the understanding of that material. So how do we do that, right? How do we do that? We need to start working together and actively studying, right? So how do we do that? Many different ways. I will tell you my favorite way that I teach the students that I work with and my own students, because I'm an educator, how to do this is writing your own exam questions. Because, guys, that can be really, really difficult. Writing exam questions is hard because not only I can give you the right answer constantly, but I have to give you the wrong answer too and write in a rationale on why that is wrong. And that really helps you fully understand that concept. So try doing that. Creating study guides off a topic, formulating those questions. Like I said, being the teacher. I like to joke it. You don't have somebody that you can talk to? Guys, pets and stuffed animals do wonders. They can do the same thing. They just can't talk back, right? Deriving those examples from your own experiences. That's probably one of the best ways that I learn is being able to pull those examples in. Studying in terms of questions, evidence, and conclusion. What is the actual question? And rewording that in your head. Flashcards. Flashcards really, really help. They really do. It's a quick option when you're on the go. Am I saying, let's run to the store to get all of the index cards we can do so I can make flashcards? No, guys. We're in the 21st century, right? We have computers, right? Google some free flashcards. We can do that too. It is really great for memorization. I will tell you, flashcards help wonders if you are struggling in farm because it's going to be that constant repetition, that constant in your face information, right? It helps you help. I would always recommend grouping knowledge together to learn topics. It kind of helps determine similarities and differences. Let me tell you, the best one example I can give you that is our endocrine problems, right? Determine those similarities and differences. Here's an example of a very quick flashcard that you can do. Like I said, farm is a fantastic option for that. Taking notes, right? Taking notes and rewriting notes can help solidify the information. But guys, like I said earlier, it doesn't do you any good if you don't go back and review your notes, right? So if you write the notes in a way that you will understand, maybe it's color coding, maybe it's grouping information together, maybe it's based off of areas on the NCLEX test plan, whatever. Do it in a way that it's going to help you the most. Again, guys, trial and error. You're not going to know if something is going to work until you try it. You have to keep trying it to see if it's going to work. So I'm going to ask you, how many of you probably take notes, right? Do you regularly review your notes? That's the big thing. Do you go back and review your notes? Right? It's perfectly fine if it's fantastic sitting in this notebook, right? But you have to go back and review it because you writing it down once is not going to do anything about it. The other thing you can do is do concept maps. If you are a concept mapper, more power to you, right? But do some concept maps. You can do concept maps based off of, like this example here, antihypertensive medications. You can do it based off of disease processes. You can do it based off of, concepts like perfusion, respiratory, endocrine, something of that nature. So it helps again group those kinds of things to do. Venn diagrams kind of help with that too. That's going to help with that comparing those similarities and differences. Again, endocrine is the best example that I can give for that one. So getting the most out of those concept maps. Guys, I know ChatGPT can make me concept maps. I've done it. But handwriting them actually helps increase that retention, right? It really does. Using those different colors, color coding. I am a big proponent of color coding. My schedule and my refrigerator is different colors. Try to make a new concept map every couple of days. That's going to help you focus on multiple concepts and keeps you on your toes, right? Prioritizing that content. But guys, again, same with the notes. You have to go regularly reviewing them and revising them. If you're auditory, let's go back to listen to it, right? Get those headphones out, whichever headphones you like, right? And listen to the information more than once. Really, really look at those podcasts. We have Paul Stin at Archer, right? Use those podcasts. I know that our CEO Morgan does podcasts all the time, and I love listening to them. Listening to the lectures again, that's going to help you with that. Do it in the car. I have an hour and 15-minute drive to work. I listen to podcasts all the time, right? If you're exercising, that's another good way to do it because it's constantly in your brain reviewing it. Teaching someone. We kind of talked about this. If you're able to teach somebody topics, right, and information, and you're really doing it good, um, and you feel that you covering all that content, fantastic. But when you're teaching somebody, it's okay not to cover all of that content. It's if you're missing something, that's fine. Just go back, make a note of it, go back to your notes and review it. Did you miss anything? Did you not miss anything? If you didn't, fantastic. If you did, let's reiterate the information that we missed. And again, you don't have to have groups of people, right? Pets, stuffed animals, roommates, they do wonders. Organizing that like information, right? It's going to really help determine those similarities and those differences, like our adverse effects on medications, right? Lists help study information in a way to help eliminate one thing you need to memorize. Comparing insulin is a huge example of this, right? Knowing that what's the time, the onset time, general ideas, those kinds of things. Mnemonics. Okay, I'm old and I know I'm old, but let me tell you, I still remember from, I had to have been elementary school. Please excuse my dear Aunt Sally. Okay, some of you are probably chuckling right now, but please excuse my dear Aunt Sally are my orders of operation, right, for math. So if you can come up with some mnemonics, believe me, I have been in education for quite some time now. I probably heard my fair share of mnemonics. Some of them are not appropriate, but making sure that you know them, that you can use to understand that material is more power to you, right? And we provide some of those things too in our cheat sheets. This is an example of our like information, clumping that like information together. Making your own mnemonics, right? AFib treats A, B, C, D, E, anticoagulants, beta blockers, calcium channel blockers, DILT, and our EKG, right? Think of those kinds of things. I think of one that, it's a poem. If you have, it's the block poem. If you have, or lower or longer drop, then you have a winky block, right? That's going to be for our second degree heart blocks. So think of those kind of things. Now, again, guys, I'm going to ask you again because it's so important. Do you regularly review your notes? Be honest with ourselves. All right. Now let's talk about some study plans. Okay. So here at Archer, we have quite a few study plans. I always like to recommend our 6-week study plan. And this kind of covers through weeks 1 through 6, Monday through Sunday. Sundays are kind of always our off days or catch-up days. I always like to think about when we're talking about study plans, guys, remember this is 100% manipulatable for you, your life, and your schedule, okay? So please always keep that in mind. Here's some QR codes if you'd like to recommend, or I recommend our SurePass. Write our own questions, right? I kind of mentioned this and spoke about this already once. It's going to help you think through the why behind the question, right? Writing that rationale. Pick a topic that you're struggling in, okay? Think about how NCLEX would assess your knowledge on that topic, okay? Determine the correct answer. That's the easy part, right, guys? Then I want you to write plausible answers that you could sit there and trick you. What could NCLEX do to trick you, right? And then write a rationale for the correct and incorrect answers, okay? So, has anybody ever tried this? It's a little difficult. It really is difficult. All right, now let's talk about time management, right? This is a big one, time management. Think about that. How good are you with your time management? Do you use your time appropriately? Are you studying most effectively? Hmm? Are we? The first thing about time management is getting organized, right? Having a plan. We have our 6 week plan, our 3 week, 4 week, 9 week, 12 week, whatever you want. We have a plan, but getting organized with that plan. I am one person, I work, right? I have children. So if I had to do this, I would actually have to point and write out my plan with my life plan too, my life schedule. So a planner, some sort of time management system that's going to work and stick with it, right? So we have our, weekly, monthly, daily ones. No matter what stage you're in, you need to figure out how to plan these things. Setting goals. Setting goals is another one. Always want to make them smart, right? We talk about SMART goals all the time. So making those smart. But guys, you want to set short-term and long-term just like we do in nursing. You want to try to stick to it, right? If you can't and you come across a goal that you're not meeting, it's okay. Just keep it up for the next week. But if you're constantly not meeting that goal, then we need to go back and reevaluate that, right? A quick tip on how to be successful in NCLEX is to do those practice questions daily, even if it's just a couple questions daily. Doesn't matter. I'm not saying sit down and do 85 questions a day. Just do a couple questions. Having that consistency. Having effective study time. Think about the environment that you're studying in. Do you study well in it? Do you get anxious whenever your study environment is not clean, right? Is it organized? Do you have all of the stuff that you need readily available, like a pen, notebook, highlighter, whatever? Don't study too much at a time, guys. I really like to think that it is really important that we sit down and kind of relax a little bit, right? Trust your body. If your body's like sitting there like this, like you can't pay attention anymore, then pause the video. If you're watching a video, step away, then come back, right? Try to have some minimal distractions. So if your kiddos are home, try to study while they're napping or put on a movie or something like that for them, right? Try to have those minimal distractions. Some individuals love to do a 30-30, which means 30 minutes on, 30 minutes off multiple times a day. It's another way you can do that, studying too much at a time. You can break that down anytime you want, 45, 15, whatever. Don't get started early. Don't procrastinate, right? That's a big thing. Don't procrastinate, because the longer you procrastinate, guys, how often have you procrastinated so much that you're not going to do it, right? So go through all of that and know your why, right? Always go back to your why. Why did you go back to nursing school? Why did you want to do this? Following that study plan is going to be really important. Create a plan and work backwards from your test date. Do not cram. Remember, this is a marathon, not a sprint race. Time should correlate with biggest topics. Once you know something, move on from it, right? Move on from it. Go through it, what you want to do, right? So think about this. Write down when you plan to take your NCLEX. Then you're going to work backwards, okay? So now you're asking how to answer NCLEX style questions. How do I do that? Guys, the best way to do that is practice. Practice makes perfect. We say it all the time, right? Answer as many questions as you can. The more exposure to a topic you're going to have, the better chance that you're going to be able to getting it correct, right? And then going back and reevaluating and revisiting those to kind of see, is it a constant topic that you're missing? Set a goal on how many questions that you want to answer in a day. That's where those study plans are going to kind of come into play and help out with that. Read the rationales, even if you get it right. Because guys, how many times have you sat there and guessed a question and got it right, but you really didn't feel confident about that material, right? So really making sure that you go back and read those questions. Breaking down a question. One answer and multiple choice answers, right? Multiple answers. Are the answers opposite of one another? If so, they both can't be correct. Go back to your prioritization frameworks, ABCs of nursing, Maslow's hierarchy of needs, right? Plan what type of answer that they are looking for. And guys, making sure that you pick out those keywords. So let's do this NCLEX style question together, okay? A client was admitted to the ER due to low serum calcium levels. Upon further examination, he demonstrates carpopedal spasms and reports numbness in his lips and hands. An ECG was taken and revealed prolonged QT intervals. Upon assessment of the client, the nurses should suspect which condition? Okay, so calcium levels. Well, I know calcium levels do not have to do with my thyroid, so I can get rid of that, right? Low calcium levels are going to talk about hypoparathyroidism, right? So I have numbness in my lips and hands, that carpopedal spasms, and prolonged QT interval. That's going to be my hypoparathyroidism. Analyzing your tests. After each practice questions or sets of questions, figure out what you missed. This is why you need to go back and read your explanations, right? Make a note. Keep that notebook of the topics that you missed. Are there those topics that are more frequently coming up that you're missing, right? Did you, are you, also I want you to analyze, okay, did you miss it because due to content, misreading the question, missing keywords, those kinds of things. Now, last, we're going to talk about testing anxiety. Do you struggle with testing anxiety? I know a lot of people do. And it's okay. It really is okay. Nope. So, testing anxiety, what is it? It's a performance stressor, right? Sometimes in nursing school and NCLEX, we have those, what we call high stakes testing. NCLEX is a high stakes testing. This can lead to a lot of added testing anxiety because not doing well can have a huge impact. And that anxiety can actually lead to thought blocking, that you cannot recall information on stuff that you previously know that you knew, right? It is due to this feeling that you must perform at your best all the time, right? So we need to figure out ways to combat that testing anxiety, right? Having adequate preparation. Guys, Archer Review is your one-stop shop for that NCLEX review. Having mock exams, doing your readiness exams and CAT exams. Making sure that you are seeking support from a friend, an instructor, peer groups, right? Small group tutors. During the exam, I want you to make sure that you are using tips for studying that we've talked about and answering test questions. But during the exam, we need you to recognize that you're going into that having that testing anxiety and what your triggers are. And the second that you start recognizing your triggers, we're going to do something about it. First and foremost, positive self-talk starts today, guys. Starts today, okay? I want you to start thinking, I got this. I'm going to rock this. I'm going to be a fantastic nurse. No matter how many times you've tested before, you're going to do it. Deep breathing. Deep breathing actually puts pressure on that vagus nerve, decreasing that fight or flight. And I actually like to kind of take that a little bit further, and I go to my happy place while I'm doing my deep breathing. So it's going to help redirect my focus. That guided imagery is going to ground me. My happy place happens to be the beach, not the 18 inches of snow we have outside right now. So deep breathing is going to calm me, decreasing that fight or flight, and my beach is going to ground me. Okay? You can also do some releasing tension. So some general strategies for the test. You want to research has shown about after 2 minutes that an answer isn't going to come to you. It's best just to give it your best guess and move on. Use other test taking strategies to help narrow down those answers. Go with your gut, guys. You have studied for this exam your entire time in nursing school and your entire time that you've been prepping. So go with the gut. Do not change your answer. Do not self-evaluate. So don't think about how many select all and apply questions you've had. Don't think of how many case study questions you've had. You need to make sure that you're giving 100% concentration on the current question that you have. Okay? And some advice for next gen. Read the question first, guys. This way you know what the question is that you're looking for. As you go through the case study information, use your whiteboard to write down that key information that you think is important as you go through the questions. That way you can just refer to your whiteboard and not having to go back into that narrative. Go through the information 1 to 2 sentences at a time. And guys, use all of your resources. Slides, skeleton notes, on-demand lectures, QBank, case studies, Pulsed In, our Pod Pulse, flashcards. Use all of those. And I want you guys to think about it. What questions do you have? Did you find this helpful? And I thank you very much for joining me, guys. Here at Archer, we do across the nursing lifespan from pre-nursing all the way up to nurse practitioner, so keep that in mind. And thank you, guys. I really appreciate you spending some time with me tonight. Best of luck to every one of you.